Robert Murphy is a professor of infectious diseases at Northwestern University. Good morning.
Good morning.
The WHO and the U.S. government, are they giving different advice on masks?
Yeah, they are, but they're dealing with completely different populations. WHO is focused really globally, worldwide, really not so much the United States. We have, despite our problem getting more people vaccinated relative to other countries, we're doing pretty well. I mean, other than the United Kingdom and us, we're towards the top. And that's what's blunting the response now, the new case rate. But you look at countries in Africa, it's less than 1%. In other countries in 5–10% range, and Arkansas at 34%, whatever they are. I mean, that's where the cases are coming. So WHO, they look at it globally. So they say everyone use masks.
But here in Chicago, U.S., they're saying, if you are vaccinated, you do not need to wear a mask.
Our guidelines have not changed. Now, it changed a little bit in that Dr. Walensky, the head of the CDC, said, look, if you're in an area, because it's so unevenly spread around the United States, if you're in an area that's having an uptick, go ahead, put in whatever you need to do. So like LA County now is back to using masks. And so many states should go back to doing it, and in certain areas. So it's all dependent on the state. So she's not going to overrule or override any local health system.
There's a German study about blood cells. What is it telling us about COVID?
Well, we don't understand why, some people, say 100 people get COVID, 1 to 2 of them will die. 10 to 15 end up in the hospital, really sick. Many of them go to the ICU. So, 14% of everybody who gets COVID gets long hauler symptom. We don't understand why that happens. Why is it different from one person and another, even if they have the same sort of background? So we're looking scientifically. So these German scientists have found that in people with really bad COVID, the blood cells, the white cells and the red cells, are markedly disfigured and abnormal, shaped and stiffness. So, we don't know how that actually leads to bad disease or long hauler syndromes. So, but this is a start. This is how science works.
Are you saying the COVID caused those cells to change, or they were changed already and that's why they had worse symptoms?
No, because they looked at, well, that's a really good scientific question. So they looked at people with severe COVID, with mild COVID who recovered, and with people who who didn't have any COVID. It's a small study, but the only ones impacted were those ones that were really sick.
All right, let's get to viewer questions. Here's the first one. Why don't we hear about studies being done on the Johnson & Johnson vaccine? We hear updates about Pfizer and Moderna, but we don't even know how long the J&J vaccine lasts or if we need boosters.
No, this is a logical question, and in that we don't have as much information about the Johnson & Johnson vaccine because it came third, as you remember. It was the last one to be approved. And then they had the problem with the blood clots, so it got unapproved for a while. And then it came back again, and people were reluctant to use it. Then they had that problem with Emergent Solutions, a company in Maryland that was supposedly making it, and they had to throw out millions of doses. So they've stumbled along the way in terms of getting the vaccine out. So there's just less information. We will be getting more information. The good news is that we're not seeing, in people that are in the hospital, the population data does not suggest that people with Johnson & Johnson are behaving any different from the other ones. But you'll get more information shortly because it's starting to add up.
Another question, how soon can we lift the federal mask mandate from the airlines and the airports?
Well, this is another good practical question. The problem is, as I just mentioned, throughout the United States, there's a whole hodgepodge of results in terms of new COVID cases. It's not evenly distributed. And until everyone's on the same page, we've got to keep a place where people from all different regions and all different countries are mixing, which are airports. So the mask mandate is here for a while.
All right, let's, one more question. We wanted to share a photo that a viewer had commissioned for her husband. This is you
Stop it.
as a dog.
What? So this is the woman's dog. And she made it look like Dr. Murphy as a gift for her husband?
Or just any dog.
is
It
that
doesn't
right?
matter. It works.
He looks like a very smart dog.
Are you flattered or?
I love dogs. I'm a dog lover.
There you go. Well, happy Friday. Who would have thought
Happy
you'd have a dog as you?
You know you've made it. If you didn't get your question answered, Dr. Murphy answers them bi-weekly on Northwestern University's Institute for Global Health Facebook page. You can submit questions on email at globalhealthinstitute@northwestern.edu or head to our morning news